Anemia is a condition where one do not have enough healthy red blood cells to carry adequate oxygen to tissues and cells in the body. There are many forms of anemia, temporary or long-term, and can range from mild to severe. Anemia due to deficiency of iron is the most common type of anemia worldwide. Globally, an estimated 43% of children, 38% of pregnant women, and 29% of all women of reproductive age have anemia. In Malaysia, prevalence of anemia is 16% in children, 38% in pregnant women, and 24% in all women of reproductive age. Anemia due to deficiency of iron causes fatigue and low productivity, while severe anemia is associated with substantially worse mortality and cognitive and functional outcomes. When it occurs in pregnancy, anemia due to deficiency of iron may be associated with low birth weight and increased risk of maternal and perinatal mortality. Iron deficiency may be associated with adverse neurodevelopmental outcomes in young children, and if progressed to anemia, led to irreversible developmental delay in young children. Causes of anemia due to deficiency of iron include insufficient bioavailable iron in diet or decreased iron absorption, increased iron requirements during period of growth, and changes in physiological needs such as during pregnancy. For instance, demand for iron increased drastically during pregnancy, up to 9 times higher in the last trimester. Pregnant women in Malaysia is vulnerable to anemia. A nationwide cross-sectional study found that the prevalence of anemia increases with gestational age, from 12% in the first trimester to 43% in the last trimester. Association of anemia with poor maternal outcomes is well reported. Odds of maternal death were twice as high in those with severe anemia compared to those without severe anemia. Clinical features of iron deficiency include soft nails, dermatitis at the corner of the mouth, mood changes, muscle weakness, fatigue, shortness of breath, dizziness, cold hands and feet, palpitations, depression, stress, and impaired immunity. Although dietary iron is better absorbed, several dietary factors have been identified to positively or negatively influence its absorption. Examples of enhancing factors are ascorbic acid, meat, fish, seafood, and fermented vegetables. While factors inhibiting iron absorption include phytates such as cereals and oats, tea, coffee, most red wines, calcium from milk or cheese, and soya. The National Coordinating Committee on Food and Nutrition of Malaysia recommend intake of iron bioavailable levels between 10 to 15%. However, common Malaysian diets have iron bioavailability of about 4 to 12%. Because dietary measures are inadequate, oral iron supplementation is recommended. Iberet Folic 500 is a complete iron supplementation, enriched with vitamin C and B complexes, including folic acid. Inside each film-coated tablet of Iberet Folic 500 is an inert, porous matrix that contains thousands of minute channel impregnated with ferrous sulfate. This unique control-release vehicle is called the gradumet. The term gradumet refers to gradual metered release, where dissolution of vitamins happen in the stomach to allow release of iron where it matters most, the duodenum. Benefits of multi-layered gradumet are independence from enzyme action, pH variation, and gut motility. With gradumet, Iberet maximizes iron absorption, minimizes gastric irritation, resulting in increased compliance.